Health insurance, also known as private medical insurance, is a policy designed to handle the expenses of private healthcare. I'll run you through different types of cover in this guide and explain what happens in the event that you have to claim. When you're choosing your policy, you can opt to pay monthly or annually, and you'll be covered for some or all of the costs if you fall ill and you want to get seen privately. Normally, health insurance doesn't cover you for any pre-existing conditions. If you're wondering why people opt to go private when we've got the NHS, it's often for the speed that you get diagnosed and treated. Despite international recognition, rising pressures in the NHS and recent challenges have prompted a shift towards private medical treatment. In 2020, the Private Healthcare Information Network reported approximately 380,000 insured patients accessing private healthcare. Though the government sets targets to reduce waiting times, challenges persist, particularly for routine procedures like hip replacements. The NHS, however, excels in delivering timely and top-notch interventions for critical issues like cardiac bypasses. Many private health insurance plans now offer access to virtual GPs, with some even allowing the choice of a private GP. This innovative approach means faster consultations and swifter treatment initiation, making sure that you receive the necessary medical care precisely when you need it. In terms of what's typically covered by health insurance, you can expect hospital charges and specialist fees to be included. This covers everything from surgery to tests, nursing fees, and meals if you find yourself admitted to the hospital. Even if you don't stay overnight, many comprehensive plans will cover outpatients consultations and treatment, encompassing diagnostic tests and various medical procedures. Surgical procedures are generally covered, and cancer treatment is often part of the package, which includes diagnosis treatment and aftercare. Some plans may even cover drugs not available on the NHS for cancer treatment. Mental health care might be included, but the extent of coverage all depends on the specific plan that you have. Additionally, other therapies like physiotherapy may be available depending on your options that you've chosen for your coverage. Now, on the flip side to this, there are certain aspects that health insurance typically doesn't cover. Pre-existing conditions, meaning any diseases, illnesses or injuries that you've had before applying for coverage, are generally excluded. Chronic conditions, those that are incurable and long-lasting like diabetes and epilepsy, are often not covered. Emergency visits to A&E departments are typically not covered since they're available to everyone through the NHS, and most private hospitals don't have emergency departments. Pregnancy and childbirth are usually not covered, although related conditions and complications that can occur outside of pregnancy may be covered. Organ transplants may not be part of the standard insurance coverage. Health insurance often excludes treatment related to drug abuse and non-essential or cosmetic procedures. It's important to carefully review the terms of your policy to understand the specific inclusions and exclusions that apply. So basically, make sure you read all the small print. Diagnostic insurance provides access to consultants and diagnostic tests to identify the root of the cause of a medical issue. Unlike comprehensive private health insurance, it only covers the expenses related to that diagnosis. This type of insurance is generally cheaper than a full private health insurance. Cash plans involve paying a modest monthly fee to have routine medical and dental expenses covered up to a specific limit. Unlike private health insurance, cash plans are versatile, allowing you to use them for ongoing and routine treatments. This option is suitable for managing everyday treatment costs like dentist visits, optician appointments, or physiotherapy sessions. Understanding the purpose behind your desire for health insurance is crucial because it will determine the specific coverage that you need. Some prioritise swift access to health services, whether it's a GP appointment or consultant care. Others want access to innovative treatments, while some aim for support in leading a healthier life to reduce the likelihood of illness. It just depends what you're after, but some look for a combination of all three aspects. When purchasing health insurance independently, the market offers a multitude of choices with over 500 private health insurers in the UK. While cost is a significant factor, you shouldn't solely rely on cost when choosing your policy. It's crucial to compare policy details and premiums to make sure that the selected policy aligns with what you need. Choosing an excess like £200, for example, may reduce premiums by 10%. Understanding the claims process is essential to ensure coverage. Health insurance policies generally admit two types of claims: cashless claims and reimbursements. The key advantage of cashless claims is their hassle-free and seamless nature. Most insurance companies have affiliations with a network of hospitals. Opting for treatment at one of these partner hospitals allows you to leverage the cashless claim option. Under a cashless claim, you don't need to pay any money directly. The insurance company settles the claim directly with the hospital. This means that you can receive treatment at network hospitals and the bills are settled by the insurance company without any out-of-pocket expenses. When you need treatment, you check the list of network hospitals and select the one that suits you the best. You have to inform your insurance company 3 to 4 days before the appointment and submit a pre-authorisation form, acting as a claim notification. When you get to the hospital, you'll need a form from the hospital's insurance desk that you fill in and then you return it back to them. Under reimbursement claims, you initially pay the bills and then after the claim's processed, the insurance provider reimburses you based on the original hospital bills. While not as simple as the cashless claims, reimbursement allows flexibility in choosing any hospital. You'll have to make sure that you have a signed claim form, hospital discharge certificate, summary report, original bills, cash memos and receipts. For accidents, submit a copy of the first information report or, if unavailable, provide a medico-legal certificate. The insurance company assesses the documents and reimburses you based on the policy's coverage. Make sure that all required documents, including valid ID, bills of equipment used during the operation, cancelled cheque, copy of the policy plan and other mandated documents are all submitted. Now that pretty much covers everything, so remember to look into all of your options before you take out your policy. Health insurance is designed to complement NHS care rather than replace it. When considering your options, prioritise what matters to you, whether it's budgeting, managing a chronic condition like back pain, or preparing for unexpected health issues. Your priorities will guide you in selecting the most suitable health insurance plan for your needs.